Saludos, Erasma here from Tambora Dialogues. Okay, so today I want to spend a few minutes talking with you about COVID. Wait, please don't click off. You'll really want to hear this because it's about your salud, about your health. I'm sure many of you have heard rumblings about this phenomenon. Okay, maybe I shouldn't call it a phenomenon because what I'm about to tell you is not a sensation like BTS. So, this thing called long COVID is real. The symptoms caused by long COVID range from exhaustion to more complex respiratory, heart, neurological, digestive, menstrual, muscular. So, in essence, every possible organ can be affected. Why am I talking to you all about it? For starters, because como dice el refrán, quien salud no tiene de todo bien carece. If you don't have health, you don't really have anything. So our health really matters. And secondly, because we know that the Latinx community in the United States got the virus at a staggering higher rate than the entire US population as a whole. Okay, I'm sorry. I'm going too fast. Here's some context. For those of you in the United States, the Latinx community accounts for approximately 19% of the population. Yet, we accounted for 24% of COVID cases and 16% of deaths. According to the Center of Disease Control, while 1 in 10 people in the US generally are impacted by long COVID, for the Latinx community, it's more like 1 in 4. Yes, 1 in 4. If you are a parent, you are 3 times more likely to experience long COVID at a rate of 23% compared to those without children, 7%. And chicas, like we don't already have so much going on, women are more likely than men to have long COVID, with 9% of women currently reporting long haul symptoms as compared to 5% of men. There are a lot of theories out there about why that is, but here's the truth: no one knows. So don't let your Tío Juan, who heard from his friend Pedro, who heard from his wife's sister Luisa, who heard from her compadre Carlos, whose sister is a nurse, that is because we menstruate. No. Children don't menstruate and they too experience high rates of long COVID. So let's wait for the research to be done to better understand the underlying factors. The good news is for those of you in the United States is that you won't have to wait long for answers because the Biden administration has invested $1 billion, $1 billion. I always wanted to do that. To have the National Institutes of Health and the Centers for Disease Control and Prevention conduct research on long COVID as part of its recovery initiative. I think it's worth repeating that this is under the Biden administration. If Republicans take hold of the Senate and the House, this might be reversed. So, to all US Latina voters, vote for your health and that of your community on November 8th. Everyone talks about family values. Health and access to quality healthcare is central to that. Okay, I'll get off my soapbox now. Moving on. Now let's turn our attention to Latin America and the Caribbean. What, y'all thought you didn't apply to you? Well, it does. Here in Latin America and the Caribbean, despite having only 8% of the world's population, we have about 13% of the global reputed acute. No, not cute. I'm talking about acute, like in severe cases of COVID 19, and 27% of confirmed deaths. According to the Lancet Regional Health Americas report, Brazil, Argentina, Colombia, Mexico, and Chile are worst affected, contributing approximately 80% of the cases. But hey, Dominicans, don't get too comfortable because doctors and scientists here have also identified that long COVID is affecting the population, mostly again, women and children. Pero nosotras no salimos de una. ¿Qué carajo? This means that Latin America and the Caribbean must also commit to number one, researching the needs of its citizens that are long COVID sufferers. Number two, equipping doctors with the tools to really assess for long COVID and to provide quality and affordable treatment options. Number three, develop policies and laws that recognize long COVID as a disability and the needed employment protections that must be associated with it. Number four, plan for the long term socioeconomic impact that long COVID will likely have on the economy and on the community. I know that we all want to move on from COVID, but COVID isn't done with us just yet. And so we must be proactive and we also must be compassionate toward long COVID sufferers and invest in our community's health. If there are any long COVID sufferers out there who need resources or more information, please reach out to me at erasma@tamboradialogues.com or DM us on Instagram or Twitter or leave a comment below and we will reach out. Please stay healthy, stay active y hasta pronto, mi gente.